Good morning to everyone, to Lázaro Manuel, to the sign language interpreter and the audience tuned in to this briefing. Today we report 1,874 hospitalized patients, 95 under medical supervision, 1,187 are suspected cases, and 592 are confirmed active cases. Yesterday, again, over 7,000 samples were processed, 7,745 to be exact, at the molecular biology laboratories of our country, 2,060 at the Tropical Medicine Institute Pedro Coury, 926 in Havana's Hygiene, Epidemiology and Microbiology Center, 800 in Villa Claras, and 377 in Santiago de Cubas. 558 samples were processed in the Genetic Engineering and Biotechnology Lab, 487 in Manuel Fajardo Hospital, 461 in the Naval Hospital, 453 in Hermanos Amejeiras Hospital, 430 in the Center for Molecular Immunology, 395 in the National Civil Defense Labs, 308 in Fructuoso Rodriguez Hospital, 299 in ICA's laboratories, 191 in the National Genetic Center. As a result of the analysis and processing of these 7,745 samples, 57 people tested positive for COVID-19. This brings the total number of samples processed since the pandemic began to 515,969, of which 4,933, or the 0.96% of people, have been diagnosed with the virus. Samples from all of the country's provinces were tested, depending on its epidemiological complexity. Pinar del Río analyzed 74, Havana the most, with 4,928, Mayabeque 228, Matanzas 112, Cienfuegos 206, Santi Spiritus increased its processing to 434, Ciego de Ávila, another province that presents a complex epidemiological situation, processed 928, Camagüey 382, and Guantánamo, with a good surveillance, processed 275, and so forth from every Cuban province. 56 of the 57 diagnosed cases yesterday are Cubans. One is a foreign resident in our country. 53 of the 57 cases, or the 93%, are confirmed case contacts and were isolated and hospitalized already. This figure therefore means that 4,423, or the 89.7% of all diagnosed cases in Cuba, have had contact with someone who had previously tested positive to the virus. The source of infection linked to 4 patients is yet to be determined, 2 patients from Havana and 2 from Ciego de Ávila, for a total of 76 over the last 15 days, whose source of infection is being investigated by our specialist. None of the 57 patients contracted the disease abroad, hence all of them are autochthonous cases. 29 patients are male and 28 are female, what represents the 50.1% and 49.9% respectively. There are not significant differences in this regard. 37 patients, that is, a 64.9% of all cases confirmed yesterday, were asymptomatic at the moment of the test, what represents the 63.8% of all confirmed cases in Cuba in the last 15 days. By age groups, 10 individuals are under the age of 20 and belong to the pediatric ages, what stands at 507 patients diagnosed in this age group, of which 88.6%, or 449, are discharged and recovered from the disease. 23 patients are between 20 and 39 years of age, 21 between 40 and 59, and 3 patients exceed 60 years of age. Of the 57 diagnosed cases, 35 belong to Ciego de Ávila, 21 to Havana, and 1 to Santi Spiritus. All of them are local transmission cases, as I mentioned. The 36 cases from Havana belong 5 to Centro Habana, 3 to Arroyo Naranjo, 3 to Guanabacoa, 2 cases each from Marianao, Habana Vieja, and Playa, and the municipalities of Boyeros, 10 de Octubre, San Miguel del Padrón, and Regla report 1 case each. The case diagnosed in Santi Spiritus is from the municipality of Yaguajay. The 17 cases from Ciego de Ávila belong 9 to Venezuela, 5 to Majagua, and 1 case each to Baraguá, Bolivia, Florencia, and Morón. I will ask Leonardo's support to bring up a map that presents Havana and Ciego de Ávila's epidemiological situation. As I mentioned, there's a significant spread of the virus in Havana province. We can see a similar behavior compared to yesterday's results, but there's been an increase in cases. There are 14 transmission events detected in this province, 1 in Plaza, 1 in Boyeros, 2 in Regla, 3 in 10 de Octubre, 4 in Arroyo Naranjo, 1 in Cerro, and 1 in Cotorro municipality. Ciego de Ávila has been providing a significant amount of cases over the last 2 or 3 weeks, and today this figure surpasses Havana's. There are 4 transmission events opened, 2 in the municipality of the same name, 1 in Majagua and 1 in Morón. Therefore, Ciego de Ávila's confirmed rate per 100,000 inhabitants is the highest in the country and increased to 56.06. Havana's decreased to 18.87, as well as Artemisa's with 10.29. Santi Spiritus' rate slightly increases to 4.94. Matanzas similar to the day before with 2.92. Camagüey with 0.78. Cienfuegos with 0.49 and Holguín 0.2 remain with similar rates. Mayabeque's rate increases to 2.86 and Pinar del Río's decreases to 1.03. Thus, Cuba's rate per 100,000 inhabitants increases to 25.14. With this analysis, of the 4,933 diagnosed patients in Cuba up to date, 592 are confirmed and hospitalized active cases, that is 12%, of which 572, or the 96.5%, present a clinically stable evolution. We did not report any deceased patient today, hence the figure of 109 COVID-19 related fatalities remains unchanged. This means that the island has a mortality rate of 2.2%, lower than the global rate of 3.16% and the regional rate of 3.46%. We always mention the 2 evacuated patients at the start of the pandemic. Yesterday, 99 patients were discharged from hospital, a positive indicator concerning the discharged and hospitalized cases ratio. 71 patients are from Havana, 12 from Artemisa, 5 from Matanzas, 4 from Pinar del Río, 2 each from Mayabeque and Granma, and 1 each from the provinces of Camagüey, Holguín, and Santiago de Cuba. Thus, we accumulate 4,230 patients, or the 86% of all diagnosed cases in Cuba recovered from the virus. 7 patients are in a critical state, hospitalized in Havana, Ciego de Ávila, and Camagüey. 13 are in serious conditions admitted to Havana, Camagüey, and Matanzas hospitals. 2 patients joined the group of those reported as serious. 1 patient joined the critical condition. 1 patient from Camagüey, who was being closely monitored, passed to be in serious conditions. 1 patient from Havana, reported as serious, is now in a critical state. And 1 patient from Holguín has evolved favorably and is now being closely monitored. Finally, I will ask Leonardo's help to bring up the updated chart that shows the indicators of disease and mortality rates per month. As you can see, in September we have reported 868 confirmed cases thus far, 14 fatalities, and a mortality rate of 0.99%, up to date, higher than August and July's rates, but lower than the mortality rates of June, May, and April. Concerning worldwide statistics, COVID-19 pandemic remains to be present in 185 countries. 301,849 people were diagnosed with the disease only yesterday, for a total amount of 29,611,395 infections. 6,877 fatalities were reported only yesterday, what brings the death toll to 935,767 and a mortality rate of 3.16%. The region of the Americas continues to be the epicenter of the pandemic and stands at 51.13% of worldwide cases, with 123,164 new infections in one day, what accounts for 15,141,313 infections. 3,955 deaths occurred in our region yesterday, for a death toll of 519,539 and a mortality rate of 3.43%. On the other hand, the United States continues to top the list of the worst affected countries by the pandemic, followed by India, Brazil, and Russia. The United States, with 6,606,293 diagnosed cases and 195,937 COVID-19 related fatalities. India, with over 5 million cases and 82,066 fatalities, and Brazil, with 4,382,263 infections and 133,119 fatalities. Now, turning the attention to the Americas region, right after the United States and Brazil comes Peru, Colombia, Mexico, Argentina, Chile, Canada, Bolivia, Ecuador, Dominican Republic, and Panama. Regarding the amount of positive cases, Cuba is placed in the 21st position in the Americas with 4,933 cases. We have indicated Mexico's mortality rate of 10.6% and Ecuador with 9.17%, being these figures significantly high. Then we have Cuba with 2.2%. This is all the information on the behavior of the pandemic in Cuba and the world.